And our guest via Skype, Hadley Heath Manning. She is a policy director at Independent Women's Forum. Welcome, Hadley.
Hi, Carrie. Thanks for having me.
Great to have you.
Hi. So you wrote an op-ed about the need for price transparency in the healthcare system. Can you expand on that?
Yeah, and I hope this is an issue that can get bipartisan support. This is something the Trump administration is trying to do through a broad set of regulatory changes. But I think there's agreement now on both the right and the left that we have enormous problems in our healthcare system. Many of those problems predated the Affordable Care Act, and they continue under the Affordable Care Act. But it has to do with how we pay for healthcare. I think the quality of healthcare available in the United States is unrivaled in the world, but what we're paying and how we're paying certainly need addressing. And whether you're someone who believes in a government monopoly in healthcare, like Medicare for All, or someone who believes in a more market-driven system, the problem is we don't have market prices for a lot of the things that we buy in healthcare, whether it's a preventive care visit with a doctor or a surgery in a hospital setting. A lot of those things we don't know what to expect to pay ahead of time. In other markets, of course, we can get pricing information ahead of time. And even afterwards, it's often hard for patients to track down, why does my bill include this line item and why did I get charged so much? And so I think the administration is onto something here. Allowing patients to have more information about what they can expect to pay and what they are actually being billed for will help people to make better decisions based on value, certainly help them to plan ahead when it comes time to pay those healthcare bills. And ultimately, I hope it will help hold costs down because competition is the greatest force for controlling prices. And it will help people, make better informed decisions about their care.
Gotcha. So Senator Bernie Sanders has announced his Medicare for All policy. He argues that by making the federal government the single purchaser of medical equipment and pharmaceuticals, it will help drive the cost of healthcare down. Do you agree with that ideology?
Well, I agree that if we move to a system like Medicare for All, we could hold prices down. On the other hand, what we're talking about when the government is setting prices are not really prices. Market prices are determined by the intersection of supply and demand. But when the government sets a price, whether it's a rate of reimbursement for a Medicare service today, as we see in the Medicare program or the Medicaid program, that's not truly a price. And so when the government does this, there's just risks on either side. The government could set a price that's too high. When they do that, they encourage overconsumption of healthcare services. Or if they set a price that's too low, which I think is more likely to be the case, especially if the government is interested in controlling costs and wants to reach that goal that Senator Sanders is describing by having lower healthcare expenditures. If the government sets a rate of reimbursement for a healthcare service that's too low, then the result will be a shortage. There will be fewer suppliers, meaning hospitals, doctors, and other providers who are willing to offer that service in the marketplace, and patients will suffer as a result.
So, Hadley, you mentioned the bipartisan appeal of this concept of healthcare transparency, and I agree. On paper, it should get bipartisan support, but there are obviously lots of forces pushing against this. That's why it hasn't happened yet. What are the primary forces that are in the way of healthcare transparency?
Well, it's interesting. I think if you talk to someone who's in the healthcare industry, whether it's a hospital or an insurance company or a drug company, sometimes these players, want to shift blame and point fingers. And there's certainly a lot going on in the healthcare system, makes it easy for people to point fingers and shift blame rather than focus on solutions. It is true that many Americans use a third-party payer to pay for the lion's share of their healthcare costs, whether that's an insurance policy or a government program like Medicare and Medicaid. This sort of perpetuates the myth that because we have third-party payers, individual patients and their families aren't interested in price information and they aren't interested in shopping around. Well, as we've seen under the Affordable Care Act, people's deductibles have been getting higher and higher, and we still have a significant uninsured population that pays cash for the healthcare services they consume. For those customers in particular, it is important to have price information, and it is important to have price transparency. And even for people with insurance, insurance that can be quite good, if you're on the hook for 20% coinsurance or a significant copay, then you'll want to know what the cost of a particular service is. And I think when people see more of how their dollars are being spent, often on their behalf within the healthcare system, then there will be more accountability and more pressure on those providers, not just to share the information, but to be more responsible with those dollars.
All right. Well, Well, Hadley Heath Manning, thanks so much for joining us. If someone wants to, I know there's a comment period happening right now. How would they get involved if they want to put a comment for the government on this?
Well, they can certainly visit iwf.org, Independent Women's Forum. That's our website. IWV.org is the Independent Women's Voice website, where you can click on a link and go through to submit a comment. Again, those are due June 3rd, but I encourage people to visit our websites, and we'll link them on through.
All right. Thanks, Hadley. And I appreciate your North Carolina map behind over your shoulder there.
Of course. Go Heels.
I used to live in Shelby, so I appreciate that.